Welcome to the first podcast from Connected by Health. Imagine living in a body that betrays you, joints that dislocate, skin that tears easily, chronic pain that no one sees. Ehlers Danlos syndromes affect up to 1 in 2,500 people, yet diagnosis and care are often delayed. We need awareness, research, and compassionate care. Join us today as we celebrate Reds for VEDS Day in honor of vascular Ehlers Danlos, as we're also joined by the wonderful Dr. Bernadette Miller, an expert in Ehlers Danlos syndromes. Dr. Miller, thank you so much for being here today.
Happy to be here.
So I'll just cut to the chase. What is Ehlers Danlos syndrome?
Well, Ehlers Danlos syndrome is a collection of 13 different inherited connective tissue disorders. And so it's a genetic condition that affects the tissues that connect our organs and our whole body. Generally, that's going to be collagen and the support proteins of collagen. And there are 13 different types that have each in their own some different features and criteria. So the features that are shared between all types are generally going to be joint hypermobility, meaning that your joints extend beyond the normal range of motion, skin hyperextensibility, and tissue fragility, or most commonly easy bruising.
So, as we are celebrating Reds for VEDS Day today, can you tell us a little bit about vascular EDS?
So thankfully, vascular EDS is one of the more rare types of Ehlers-Danlos syndrome. Specifically, approximately 1 in every 100 to 200,000 people, which is great because it's the one type that does have a shortened life expectancy. So it's a genetic mutation specifically in collagen type 3 or collagen type 1. And the patients who are affected by it have arterial fragility, which is the most dangerous condition that happens with it. And that usually involves rupture of large arteries in the brain or in the aorta. Sometimes you can have tearing of those arteries, and sometimes they can widen, which can often lead to very dangerous conditions that can lead to death. These patients also have organ fragility, so sometimes they have rupture of their internal organs, like the appendix, and then extensive bruising, and sometimes something called pneumothorax, which is where you have air that escapes your lung but is still in your chest cavity wall and prevents your lung from fully expanding. It's the third most common type of Ehlers-Danlos syndrome, but the only type that has a shortened life expectancy.
So, what are some common signs someone should look for when it comes to being concerned about having possibly EDS?
So the most common type of Ehlers-Danlos syndrome is decently common, and it's underestimated. We call it an invisible disease because it's a problem with everything that connects you. And so patients who have this generally look normal. It's about 1 in 3,000 to 1 in 5,000 people. And those people are going to have very hypermobile joints where they can bend their joints beyond the normal mobility. Their joints are going to be unstable, so they're prone to things like spraining ankles, or your knee gives out underneath you, and then chronic pain, which is a widespread pain that affects everyday life. And the most common type we don't know the genes for, and about 90% of people who have Ehlers-Danlos syndrome have the hypermobile type. So medicine is still looking into the genes, and we're getting closer, but it's still the most common type that we don't know the genes for yet. So signs are easy bruising, pain everywhere, bendy, stretchy joints, unstable joints. There's a few other things that happen pretty commonly with Ehlers-Danlos, which is dysautonomia, which means your automatic nerves don't function automatically like they're supposed to. So you may have heard of POTS syndrome, where your heart races when you stand up and you feel lightheaded and you feel like you're going to pass out, as well as a higher rate of autoimmune conditions like Hashimoto's thyroid, rheumatoid arthritis, and things like that.
So, what are some practical strategies and resources that patients can use right away to improve their daily life?
So the most important piece of advice that I can give to people is support your unstable joints. If you are prone to spraining your ankle, go get an elastic ankle brace that just gives a little bit of more tight support to your ankle. Wear high top shoes when you're going on long walks so that you don't sprain your joints. Knee braces as well. Learn about your condition. The issue with this condition is that it's an invisible condition. And so oftentimes you'll go to a primary doctor and they'll see a normal person in front of them. So if you've learned a little bit more about it, you can tell your provider what you think is going on, and then they can look into it further for you. And then probably the greatest resource that I can recommend is looking at the Ehlers Danlos Society website, which has amazing resources for learning about the different types of Ehlers Danlos syndrome, and also has a provider registry that you can search for providers of different types, such as geneticists, primary doctors. A lot of physical therapists have registered on the site. All the people on the provider registry have intentionally listed themselves there so that people who have Ehlers-Danlos syndrome can seek them out and understand and find a provider who understands the condition.
Thank you so much once again, Dr. Miller, for answering all of our questions today. And folks, don't worry, Dr. Miller will be returning back soon to our show, as we are planning on doing a full-length episode on Connected by Health podcast about Ehlers-Danlos syndrome, and she'll be answering more of our questions in the near future. And once again, don't forget, today is Reds for Veds Day. If you enjoyed our podcast today, please do listen and share with all of your loved ones and associates. Thank you so much.